Good morning, everybody. My name is Tanya Saini. This presentation will focus on vaping associated pulmonary injury. Definition. So, what exactly is vaping associated pulmonary injury? According to the National Center for Biotechnology Information, VAPI is defined as the following: vaping associated pulmonary injury, also known as EVALI, which stands for e-cigarette or vaping product use associated lung injury, is an acute or subacute respiratory illness characterized by a spectrum of clinical pathological findings mimicking various pulmonary diseases. Vaping is an action that requires inhaling and exhaling vapor using an electronic nicotine delivery system. This device is battery operated and has different flavorings. Vaping is associated with severe lung injury and can be life-threatening because it can lead to strokes, seizures, and heart attacks. So I will be discussing some background information and finding to the disorder that was assigned. So vaping first became common in the 1920s. The first e-cigarette patent was applied for in 1927, but it really wasn't until the 1980s that there was a serious attempt to commercially create them. In 2006, the first vaping products were made available in the United States. The earliest outbreak of this disease in the USA was reported in March 2019 when several cases transpired. On February 18, 2020, the CDC informed the public about 2,800 hospitalized cases of VAPI, of which 68 patients were reported dead. So, why do people exactly vape? People mainly vape because they find flavors appealing and because it is generally seen as a safe alternative to tobacco use. People would buy e-cigarettes or vaping goods under the mistaken belief that the chemicals they're inhaling are just largely water vapor, which is actually incorrect. And for smokers, they prefer the flavor and fragrance of the items over cigarettes. Usually seen in kids, the reason why kids are actually smoking is because their friends are doing it, or they want to do vaping tricks, or even to be cool. This slide will continue to explore why individuals vape. As mentioned before, individuals assume that vaping is less harmful than smoking, but it's still not safe. Smokers believe that vaping is a safer option and will help them quit smoking cigarettes. Another reason could be that it helps to release stress. The nicotine contained in e-liquids can induce a sense of relaxation and help with anxiety. Third reason is a medical reason. Vaping can help manage pain and medical conditions such as Parkinson's. Vaping can also help with migraines and chemotherapy recovery. Finally, vaping devices are cheaper than a pack of cigarettes, so therefore it helps individuals save money. This image shows a variety of e-cigarette devices. First one, which is the early generation disposables, were the Cigalikes. Then there were the tank devices, then the pod mods, and then finally the vape pens. Different types of vaping products. The first type of vaping products were the Cigalikes, which were the first generation. They are comparable to cigarette because it resembles the appearance a lot. The second ones were vape pens, which are also known as vaporizer pen. These devices are refillable. Then there were mods, which are the third generation. People used them for a longer vaping experience, had used them because they had a higher capacity and more power. Finally, there are the vape pods, also known as jewels, which is commonly used by teenagers because it has different flavors and contains nicotine. Also, it does resemble a flash drive a lot, so it is easily, so kids are easily able to hide them. Prevalence. There was an estimated 55 million e-cigarette users worldwide in 2001. Teenagers and young adults are common users. 8% of Americans had reported vaping every other week. The three countries that have the biggest purchases and retailers of vaping products, including the market, are the United States, the United Kingdom, and Japan. The table shows the age profile of U.S. vapers who vaped in the last week, and individuals from ages 18 to 29 are commonly vaping, while individuals who are 65 or above are vaping the least. There is clearly a pattern seen in this image. U.S. vaping or e-cigarette use and sales have risen dramatically since 2012. The graph below shows the growth in teens. This graph shows the percentage of U.S. teenagers who reported any vaping during the last 30 days. As you can clearly tell, teenagers between the age range from 17 to 18 are frequently using vaping devices and are using them a lot more than those that are on ages from 13 to 14 or 15 to 16. More than 3 million students currently use a tobacco product in 2022. Commonly used types of devices: e-cigarettes, cigars, cigarettes, smokeless, hookahs, nicotine pouches, heated tobacco products, and piped. Symptoms and side effects. Some side effects and symptoms include cough, dry mouth and throat, shortness of breath, mouth and throat irritation, headaches, nausea, heart palpitation, sleepiness, eye irritation, and weakened taste. Some serious side effects include severe lung injury, heart attacks, seizures, popcorn lung, and stroke. By using scans like chest x-rays or CTs, doctors can assess the history of e-cigarette users by looking for hazy gray areas on the lungs identified as opacities, which signify tissue damage. The picture here shows the difference between a normal, healthy lung versus a lung of an individual who vapes. Vaping and lung disease facts. 3 days exposure is all that is required to cause significant lung damage to pave the way for chronic lung disease to develop over time. So many people might ask what is exactly inside a e-cigarette device. Number one, flavorings. Chemicals like diacetyl can damage the lungs when inhaled and have been found in many sweet e-juice flavors such as vanilla. Number two, particles. Sometimes at levels comparable to cigarette smoke, they can increase the risk of heart disease, lung cancer, and asthma attacks and interfere with lung function. Finally, metals like lead, chromium, nickel, copper, aluminum, and mercury. Exposure can have a variety of negative health effects, including brain damage and cancer. Ways to prevent vaping. One way is to spread awareness to parents, teachers, and community about the harmful effects. To prevent the spread of tobacco, communities can work to limit the number of tobacco retail stores and their proximities to youth. Stores must require age verification when selling a product. Should be 21 plus to purchase. Conducting media campaigns to educate the teens about how ads are exploiting them. And finally, increasing the prices on vaping products. Vaping-related deaths in the USA. According to recent statistics from the Center for Disease Control and Prevention, aka CDC, 64 individuals have died recently and 2,758 have required hospitalization as a result of lung damage brought on by vaping. 80% of the patients are teens, while 20% of them are male. If you look at the image to the left, more people blame Juul for vaping deaths, even as CDC linked THC vapes to illnesses. THC and vitamin E acetate are two vape additives that are thought to play a role in the emergence of vaping-related disorder. Health experts identified vitamin E acetate as a component of many e-cigarettes that included THC and believe that these ingredients are responsible for lung damage. In addition, THC vape devices have become very popular among adolescents, and this trend is becoming widespread. THC vape devices are described as pre-filled cartridges of cannabis extract, which may include dilute and flavoring, with a battery-operated heating system. Cigarette smoking or vaping causes about 1 of every 5 deaths in the United States each year. These deaths are caused by lung cancer, heart disease, chronic pulmonary disease, stroke, or other cancers that are associated with vaping. The story of Seema Herman. Seema, 18 years of age, was addicted to vaping. The nicotine was what made her addicted. The young American went through pulmonary insufficiency. On August 15, her pulmonologist said that a chest x-ray showed white hazy areas at the bottom of her lungs. Her lungs were found to be inflamed and filled with fluid on chest x-ray. Herman had to be put on a ventilator and shortly afterward a medically induced coma. Treatment for vaping. Experts recommend antibiotics or antivirals until the infection is ruled out, as well as corticosteroids to help fight inflammation in the lungs. Other treatments that are highly suggested include being placed on a ventilator if the individual is unable to breathe. The long-term effects of e-cigarettes are still under research. Researchers are still investigating this illness and learning about its causes, preventions, and treatments to better understand it and diagnose it. Numbers of hospitalized E-Valley cases or deaths reported to CDC as of February 18, 2020. As you can see in the image, states such as California, Texas, New York, and Illinois had the highest number of cases, about 200 to 249 cases. Also, vaping is most prevalent and is seen from teenagers and young adults. The rapid rise in youth vaping has now become a public health emergency. This graph on the slide shows the increase of hospitalized patients with lung injury associated with e-cigarette use or vaping. You can see the dramatic increase of patients from 0609 to 0922. People were less aware of the consequences of vaping at this time, but as people are becoming more aware, the number and rate of hospitalized patients are decreasing. Questionnaire. Test your knowledge. Question 1. Vaping products are a healthier alternative to smoking. True or false? Question 2. What are the negative health effects of e-cigarettes? Question 3. Why do youth try e-cigarettes? Here are the answers to questions 1, 2, and 3. These are the websites that I use to gather my data and complete my presentation. The end.